Welcome back. It's Dr. Tipton here, and I just wanted to go over one of the most frequently asked questions that I get regarding direct primary care. Patients are asking me, why can't I just pay as I go? Why can't I just pay a one-time fee? I mean, I only come to the doctor once a year, they say. Well, few things. It's never just once a year. It's always more than that. That's the first thing. And secondly, this whole one-time fee, pay-as-you-go type model is the insurance system exactly, the fee-for-service model that I am trying to get away from. Or if I did accept a one-time fee for one visit, it's always confusing because after that, they might have a question about the prescription that I sent, or what about the labs I ordered, or what if I then find a problem and then they have to go to a specialist? At what point do I need to charge more? Or do I just have to be like the insurance model and have no payment for all of the work that I'm doing in between visits? It just gets messy. With direct primary care, you pay a membership. What your monthly membership is really paying for is access. That access is going to ensure that you have a trusted physician ready and waiting when you need them to provide care that you can trust. And that long-term relationship is going to be the most valuable tool that you have to help you get healthy and stay healthy. So let me just give you a couple examples. Now, I have changed the names of these people to protect their identity, but these are literally things that have just happened in the last couple weeks in my practice. We've got Susan. She comes in to see me and she's been coughing for 4 weeks. And it's really annoying because whenever she coughs, she pees her pants. And I also happen to know that her kids all have asthma. And I also happen to know that the 2 people that she saw in between gave her these pills that are supposed to help reduce cough, did nothing for her. So I happen to remember, because I know her from a long time, that 3 years ago she had the same exact thing. I gave her like 3 days of steroids and she was dramatically better. So I just reminded her of that and we did that and her cough was gone. Next we have Janet. Janet was having some leg pain. We found out she had a blood clot. And then a few days later realized it was actually a pulmonary embolism, which is a blood clot in your lungs, which is very bad. And at this point, I'm thinking, what is going on? There is too many things happening at once. This person, again, I've known for a decade. She's never had anything like this. So then I kind of think, there was those episodes of joint pain that you were having. And then remember when you had the swollen lymph nodes and everything that we were dealing with? And then there was a few other strange symptoms. So she and I were talking and I told her, I just really think there's something underlying that is making you all of a sudden have blood clots. We did some more testing and turns out she has atypical rheumatoid arthritis. Now that's a lot different treatment than just blood thinners for a blood clot. Last one is Jessica. She came to my office several times, not to see me, but she had like various joint complaints. But they got kind of different diagnoses because these are people who don't know her from anyone, and they just were like, oh, maybe it's gout, or maybe you like strained your wrist or something. So I've been seeing her for like a dozen years, and when I saw her, I said, I think there was this autoimmune lung diagnosis you told me about back at a different hospital, like that might be related. And sure enough, everything kind of started fitting together. We diagnosed her with lupus. And then we're stuck with a 9-month wait for rheumatology in general. But because, again, I knew her for so long, I had worked her up, I was able to get her in within a month. And then during that time, she was even started on medications. And she was so happy after a month to have the correct diagnosis and the correct medication and to already have an appointment with the specialist. So it's not that I am so smart, because these are just things that any doctor would know if they had a longer term relationship with the patient. The other people seeing these patients are skilled. They're just in a different relationship. They're operating in the insurance model, the one-time visit. And I can promise you, because I've been there, the insurance system does nothing to incentivize us to really think harder about a patient, to do research about their past history. The insurance system does not incentivize us to coordinate care or talk to other specialists. In fact, the incentives are basically set up for us to not do any of those things. And this is why direct primary care is so much better and why I am done with the insurance-based model. It's based on that once pay-as-you-go, fee-for-service, and that is part of what's wrong with medicine, and that's why I'm not going to do it in the direct primary care model. Because in DPC, I get paid when people stay healthy, and in the insurance model, I'm really only paid when they're sick. With direct primary care, we can just keep people healthier, and that is the beauty of DPC. If you have more questions about direct primary care, just check out my website, which is linked below. There's a frequently asked questions section, and you can even email us at hello@blossomdpc.com.